Hi, my name's Allie, and I'm a research assistant with CWP. I work with Jenny and Fiona, and I'm on the Next Step team for the last year and a half. It's really good to be here with you all today and to get a chance to present the fruit of our labors. So that's really exciting. So I'm happy to be up here talking to you about some of the findings from our studies, the last two studies on the Next Step cards. Just a little thing with our names on it there. So first of all, we just want to set the context of these studies for you and talk about why we've been doing the research on the Next Step cards. We are aware that unfortunately there are many children and young people in the UK who struggle with emotional well-being or have mental health difficulties. I know many of you probably already know this from your direct experience working with the kids in your schools or in your communities, wherever it is that you're positioned. And the recent stats do reflect this. So for example, 10% of children or of young people aged 10 to 17 in the UK have been struggling with their emotional well-being recently, and another survey from just a year before that found that 18% of young people in the younger age group from 7 to 16 years old struggle with symptoms of mental health disorders. And on top of all this, the data shows that more and more young people are struggling to access mental health support from public services such as the NHS. It is a difficult reality to face, but there have been some initiatives over the last almost 10 years now, such as the Thrive framework, which came up with a way to support and manage the mental health of these young people and their families. And the key points are just that mainly in order to best support the young people here, and in light of the kind of harsh reality of some of the barriers to using the mental health services, we have to try a multi-agency approach. So maybe the mental health professionals are not the only ones who are able to help. Maybe teachers, teaching assistants, maybe nurses, parents, anybody else like that who might come into contact with the children in kind of a meaningful sense are all actually very well positioned to help. And this involves a non-pathologizing approach, which means that we don't want to overemphasize diagnostic labels, for example, and we just try to normalize the well-being struggles as human struggles, for example. Collaboration is important, accessibility, having accessible support, having timely support, support from trusted adults is really important. And some of these ideas are linked to this 2015 paper called the Green Paper, which talked about young people's mental health and that it should be supported by the schools they attend, for example. And finally, we know that sense of agency and having some kind of, giving children some kind of autonomy or choice in their life, but especially in their mental health, is really important for their well-being and probably most people's well-being. So any kind of intervention or tool that can cultivate this is going to be ideal. I don't think I need to explain the Next Step cards to anybody here. I think you all know what they are. But I do want to briefly mention the difference between this tool and other tools out there. There is sort of this term augmentative and alternative communication tools. So the Next Step cards could maybe fall under that umbrella in a way. And some of these tools exist specifically to help children or kids who are maybe nonverbal or struggle in general to communicate with others. And their goals overlap in that they do try to help people, children express their thoughts and feelings and needs. Maybe some of you here have even used other types of cards like this. But the key difference between those types of cards and the Next Step cards are that the Next Step cards specifically help children and young people to improve their emotional well-being and figure out what steps they can take on their own terms, in their own environment, to meet certain goals. So we did complete one study last year, gathering the practitioner perspectives on the Next Step cards. And some of you maybe completed this questionnaire. If you did, thank you. You're amazing. This was a mixed survey, meaning that we collected mainly quantitative data, but we left open the possibility for the survey takers to add some qualitative comments, just elaborating on their answers if they had anything that they wanted to add to the way that they answered the questions. And this was very helpful. It was actually so helpful that we decided to do a second study looking a little bit more in depth at the practitioners' views. And we definitely needed to talk to the children and young people as well to get their perspective, to get their views on the cards. So that's what the second study was about. The current and latest study that we did aimed to capture in more depth experiences of the trained practitioners and to capture the perspectives of the young people on using the Next Step cards. So we did this in 2 phases. First of all, we did some interviews with the practitioners who could have the space to talk openly and really share their full perspectives in depth, the good and the bad, the challenges and the successes, just anything that they wanted to share about the Next Step cards. And second, we facilitated a focus group for the young people to be able to share their views as well. We wondered whether it would be better to kind of talk to them individually or as a group, and we chose the group format because it works really well and it helps the kids feel a little bit more comfortable having their peers next to them and kind of a little bit safer than maybe one-to-one with a researcher with a strange American accent, for example. And it helps the kids to, if they're really shy or they get stuck and they can't think of what to say, just kind of, bounce some ideas off of each other and kind of help things stimulate further reflection, basically, which is helpful for the study. So we contacted 27 Berkeley Academy staff members trained in June of last year and invited them to speak with us. And we also asked for their help in contacting the students in years 1 to 6 with whom they use the cards. And if any Berkeley people are here today, thank you so much. Again, you've been very helpful. So a huge thank you to the school. In phase 1, we spoke to the school staff on Teams, so we did it online, and we asked them to share their experiences with using the cards. We were not looking for any particular answers, we just wanted to know in general how they were working in that context. And some of the questions were, I don't know, it's kind of hard to read up here, so I'll read it. But how do you decide which children to use the cards with? Which cards do you use the most? What do you find helpful about the cards? And what don't you find helpful about the cards? So very broad, open-ended questions to give people a chance to share whatever they wanted to share. In phase 2, we interviewed the students as a group, which, as I mentioned before, was very good for helping them to feel comfortable. And we asked them questions such as, do you remember the person you used the cards with? How did the cards help you talk to him or her? What kinds of topics did you talk about? Can you remember the goals? How did this help you? Things like that. Again, trying to keep the questions very open-ended. And for both the interviews and the focus group, we plan to use thematic analysis to discover themes and patterns in what the participants shared. And this can be very good for finding kind of new things that maybe we haven't thought of when we created the questionnaire before. And this is sort of a specific research method that involves getting familiar with the data, attaching codes, turning the codes into themes, reviewing and defining the themes, and then presenting and organizing the themes in a cohesive way. We ended up interviewing 3 Berkeley Academy staff members. Just so happens that 1 was male and 2 were females. We like to report, a little bit about kind of the people that we interviewed. They had different roles in the school, and the average interview length was 19 minutes. So these people were very, very generous. They donated their precious time during their school day to speak with us, and we really appreciated that. This is an overall picture of the themes that we derived from the data. So we have, these are from the practitioner interviews, which I'll talk about first. And on the left side, you can see that there are 5 key themes, and on the right side are the sub-themes connected to the key themes. So I'll just read you if it's hard to see. The top one says cards. The cards supported experienced school staff. So these people had lots of experience and background working with kids, but it's interesting that the cards also helped them. Flexibility of the cards is number 2, and some of the sub-themes, it's the bubbles next to it with kind of the arrows pointing to the left. So some of the themes that they talked about were the timing of the cards. They had comments about that, how it worked or didn't work. Personalization, so meaning how much were the cards able to be personalized by the practitioners and by the young people, and then sort of what were their processes in identifying the young people. So they kind of went about that in different ways. This is the fun part after all the research stuff. So here are some of the quotes, and we have a recording, not of the actual practitioners, but of an adult voice reading the quotes out loud to kind of make it a little bit more, feel more real, I don't know. But yeah, it adds a little something here, so I'll just play this.
And it then got to the point where he used the wordings from the next steps. And he actually got to the point where he didn't need the cards, but he just knew what he needed to do. For other children, it could be that they've been identified as something's happened at home, or parents have discussed the fact that they feel like their children are struggling with something, but they're not necessarily feeling like they're skilled enough to sort of try and start the conversation. Giving them a tool, and then I guess the concern is making sure that there's sort of safe places, to then have the conversation and contain whatever comes up.
Actually, let me go back to that one more time. So I think those are really poignant quotes because they sort of align with what the themes were that I mentioned before. We sort of talked about the cards kind of, or the practitioners talked about the cards filling in the gaps for the parents. Maybe the parents really wanted to help, but they didn't quite have the tools, and so the cards sort of filled that gap in. The other quote was sort of about a student internalizing the cards and actually not even needing the cards eventually, sort of memorizing and kind of internalizing the process of setting the goals and reaching the goals. So that was really cool. And then also the last quote was somebody talking about how the cards worked so well in a way that they really opened up conversations, and this person was talking about how there was a little bit of concern around that, about vulnerability and sort of what do you do with that then when you're young people, the children in those contexts are actually sharing deep things. So that was very interesting. Are we okay with time?
Yeah.
Okay. So phase 2, I just want to talk about these results. We had 5 students in the focus group. They all happened to be females. We didn't plan it that way, but just sort of the way recruiting works. Sometimes you just get what you get. But that was great. And they were all aged 10 to 11. They were super adorable. I really enjoyed talking to them. They were very wonderful children. And they spoke for 28 minutes total. So they did a really good job, sitting around a table and kind of, in the middle of their school day as well. They took time to do this. So we made sure they felt appreciated and valued for that. And they also said it was a relaxing experience. That's what somebody said. So I thought that was cute. And these are their themes that came out of what they said. So they had 4 key themes. You might notice some of these do overlap with what the young people or the practitioners shared. And some of their themes were they appreciated the flexible use of the cards. And so they talked about, all of the ways in which they used them, sometimes not even how we imagined they would be used. And they talked about all the different ways, or all the different people they kind of use them with. So actually not just the adults, they talked about using them with each other and sort of teaching the cards to each other. Cards supported communication was the third one, and the cards supported goal setting and achieving. And we've also got a recording of child quotes.
I like to choose what number I am and then try and make it go up numbers every single time I do it. I think they need like a few more options, and like the different things, like say one day you're feeling horrible because something really bad has happened. Kind of like the way they're all colourful and it shows all the pictures and stuff, because it makes you more comfortable with them, and if it was just words you might not be comfortable with them or something.
Aren't those adorable? I mean, come on. So again, like, what they shared, we've sort of incorporate these into larger themes. And I think maybe the most, well, in my opinion, one of the most poignant ones was the quote about really taking ownership and sort of, it's not really she's not talking about an adult who kind of sets her goals and pushes her, towards the goals, but she's talking about she, used the cards herself, and then she made herself go up a number. So it shows a lot of, I think, autonomy and sort of ownership of the cards, and using them in a meaningful way. So not just adult-led or adult-initiated. So we thought that was really cool. Okay, we're almost to the end. In the discussion, this is where we talk about what are the practical implications, what are the theoretical implications, sort of the takeaway message for these studies, for the practitioners, and also for the young people, definitely. So first of all, from this recent study, we do have findings that support and align with the practitioner survey. So that means that that adds validity to the findings from the previous study. But not only this, the practitioner interviews and the focus group did provide more in-depth understanding of how the cards are being used on a practical level. For example, the quote from the child who said she's making herself move up. So she's really taking initiative and ownership of the cards to set and achieve her own goals without prompting from the adults. Of course, having young people's views in general is extremely valuable, and it helps that the young people and the practitioners shared similar content about their experience using the Next Step cards. And from this particular study, we can see how the cards are being used in a school setting. So it gives us a little bit more in-depth insight into schools, and we know that not every school will be the same, and not every child will use the cards in the same way. But it's helpful to know that it seems to be working in at least one school setting. And we also found that the personalization elements of the cards are very helpful, and the children like it, the practitioners like it, and maybe there are ways that we can continue adapting, the Next Step team can continue adapting those cards, or encouraging practitioners to use it in that way if that's what the children are requesting, being able to adapt it to the particular child or the situation. And finally, that this personalization or this opening up of the conversation, it can come with some cautions. For example, if we do encourage a child to open up and be vulnerable, are we able to manage it safely? Where is the line, between sharing and I guess oversharing, is if that's a thing? Can we manage that safely and effectively? Is there a reason to put a limit on the cards, or is it necessary to provide additional guided training or supervision to practitioners? So those are some of the important questions we are left with. And in terms of future direction, if we do follow-up studies, we would want to know not just kind of people's opinions and experiences, but we might want to be able to measure specific outcomes in a more quantitative way. For example, comparing groups. So you might take a group of children that have experienced the cards and a group that haven't, and sort of compare, does it make a difference for their well-being, maybe for like their success in school, or how they feel kind of about their home life. So there might be ways to measure that. And also for the practitioners, does it make an impact on their confidence, or anybody, I mean, any adult who's using these cards with the children, does it make an impact on their confidence or on their sort of therapeutic skills in using the cards? So these are just a few questions we're curious about, and for future studies, if we get a chance to, we'd love to take a look at that, and maybe you have some ideas too about what we could look at next. So thank you very much. Thanks for listening, and have a great rest of your afternoon.